Okay, so now I want to talk about the clinical assistant license in Manitoba, okay? And the clinical assistant license in Manitoba has a lot of interesting things for us to talk about. Manitoba is the only province in Canada where it's possible for someone to be a clinical assistant and not be a physician. However, I'm not going to go on that because all of you that are listening to me are physicians, and I want to talk about something else that is also interesting about the clinical assistant license in Manitoba. Number one is that they have a program called Clinical Assistant Assessment Program. So Clinical Assistant Assessment Program. This program was created for people who do not have any other exams. So basically, let's say you don't have the QE1, you don't have NAC, you want to get a clinical assistant license in Manitoba, you can join the Clinical Assistant Assessment Program, or CAA, and they will do the assessment of your training or of your knowledge as part of that program. So it's as if it's a substitute for the QE1, okay? It's not an assessment of your training such as the Practice Ready Assessment. It is a program where they will assess whether or not you're ready to be a clinical assistant, okay? So basically for us physicians, the requirement is that you have to have an MD degree or equivalent from a faculty of medicine that is recognized. If you did your source verification and the physicians accepted your degree, they will accept it as well, okay? And then you're gonna apply with the College of Physicians and Surgeons of Manitoba. You're gonna submit their documentation, and this program runs around twice a year as long as there's enough people to run the program. And how is the program, how does it happen? So basically there's a part one, which is written examination. And then there is part two, which is an OSCE. So basically, as you can see, it's as if this program would substitute the QE1 and the NAC for people who maybe didn't pass or couldn't take it or or don't want to do that program and those exams and want to do this program, okay? So why would you participate in this program? Because if you participate in the program and you're successful in the written and the OSCE, you would then be invited. So if successful, you are invited to apply for a clinical assistant license in Manitoba, okay? So it might be an interesting option for people who don't have the other requirements that are needed. Now, I want to talk about the clinical assistant license itself, okay? So when we're talking about the clinical assistant license, what are the requirements? So number one for the requirements is that in terms of exams. So as I said, for the Practice Ready Assessment, they only accept the NAC. For the clinical assistant, they accept QE1 or NAC, or a successful completion of the CAA program, okay? You only need one of these to be able to fulfill the criteria regarding examinations. Okay, so as I said, you need one of these, either the QE1 or NAC, or this successful completion of the Clinical Assistant Assessment Program in Manitoba, okay? Now, what is really interesting about Manitoba as well is that there is no requirement of postgraduate training, so you don't need to have done at least 1 year of postgraduate training, and also there is no requirement regarding independent practice. So even if you never practice independently, you are able to apply for this license, and also there is no requirement regarding gap. So they don't mention about the gap. So there's no problem with the gap, there's no problem with postgraduate training, and there's no requirement for independent practice experience, okay? So this is really, really attractive for many people who have the QE1, but they don't have any other of the other requirements, okay? So this might be attractive. You will be able to start practicing as a clinical assistant. As I said, clinical assistant currently only breaks gap if you're applying for a practice ready assessment in Ontario, but it does not make up for the lack of independent practice experience. So for example, in Ontario, you need to have 3 years of independent practice experience. So that requirement is still there. But let's say that before you had a 5-year gap, you're not practicing, and now you have some time of clinical assistant license in Manitoba, you're able to break that gap and go back to practice in Ontario. Okay? So this is very interesting about Manitoba, and I will now just briefly highlight what we discussed and what are the main things here that I want you guys to remember. So first, Manitoba is the only province that has a specific program that can be a substitute for examinations if you don't have the QE1 or a NAC. It is basically a program that you will do a written and then an OSCE, and it will be enough for you to be able to get a clinical assistant license in Manitoba. If you have the QE1 or a NAC, or you completed that program, you are eligible for a clinical assistant license in Manitoba. You do need to go through the college and you need to find a job offer and be successful in securing a job. But if you are successful securing a job, you are then eligible to get a license. Okay? So I think this is really interesting. It's one of the provinces that allow the clinical assistant license in Manitoba really allows for a lot of people to get their feet wet and then start in the Canadian healthcare system while they work on other licenses. Okay, so stay tuned. I will continue talking about other licenses, but meanwhile, if you have any questions, make sure to leave it on the comments below. I'll see you soon.